COVID-19, it has like never before the importance of technology has come. People have every institute, has become a healthcare institute now. The smallest shop, a retail shop in the market, has become a healthcare institute.
Greetings, ladies and gentlemen. Today it is an honor and a pleasure for me to introduce you all to this particular session where we are going to know more about the future of healthcare. My name is Harsh and I'm going to moderate this session for all of you, wherein I'm going to introduce you all about event and perhaps the person who is going to interact and address all of us. First of all, I request you to kindly acknowledge and welcome the presence of our esteemed guest, Madam Monika Kochar, who is here with us. I would like to request all the persons, those who are watching this session on YouTube, to kindly upload in the comment section and welcome the presence of our guest. Dr. Monika Kochar is a public health professional with a passion to improve healthcare delivery. She has an experience of 2 decades in implementation of project management, and reforming public health policy. She has extensively worked with state and national health agencies over several projects. Presently, she has been invited by the state government of Haryana to join as an executive officer with Ayushman Bharat scheme. Apart from that, she is also an expert advisor to the Government of Haryana for Poshan Abhiyan and Reducing violence against women. I believe her profile has so many things, so many glories, which I won't be able to explain in next few minutes. But I'm pretty sure during this conversation, we are going to learn a lot from her. So first of all, ma'am, I welcome you to in this session. Thank you so much for joining and agreeing to share your thoughts with us. We are extremely very happy to have you for today's talk.
Thank you, Harsh. Thank you for such a beautiful introduction. Thank you for having me here.
Yes. Thank you so much, ma'am. It's our pleasure. So moving to the topic of today's session, which we have chosen is exploring the future of healthcare in 2021 and beyond. Whenever we talk about the healthcare in 2021, the one and the foremost important thing which we can't ignore is COVID-19 vaccination. Creating a vaccine in under 1 year is no small feat. While the coronavirus pandemic made a new normal of mask wearing and physical distancing, which we all are following. Ma'am, my first question to you is, one thing which made all of us surprised is researchers created a vaccine, COVID-19 vaccine, in such a short amount of time without compromising the safety standard. So ma'am, it's a kind of request to you. Kindly explain our viewers how actually they made it possible.
See, Harsh, coronavirus or COVID-19, as we say, it came as a surprise, but not completely as a surprise for the mankind. We were kind of expecting these kind of pandemics to happen, but not so soon. So when we thought that a vaccine, we knew that a vaccine could only be a cure for this. We can have any amount of precautions, I mean the face mask or social distancing for that matter, but finally we need to find a proper cure for it, and the cure is a vaccine. As you say, we found this cure within a period of 1 year, and it is pretty soon, especially when we know that the clinical trials for any vaccine could take a long time. And this cure coming within a year is actually a surprise for the mankind. But the researchers have been working hard. The researchers have put in a lot of efforts, and then the special technologies which have been used, the genomic editing, which has been used to uncover this vaccine has helped us a lot. In the new age of technology, we know what kind of a phenotype this virus has, and targeting that phenotype is important without compromising on the safety of human body, So that is one reason why this vaccine has come out so soon, and we haven't actually compromised on any kind of safety measures as well. That's it.
All right, ma'am. I think you have covered all aspects and explained very beautifully. Ma'am, my next question to you is when we are actually the means finding the question for this session and covering all questions. One question which was very common in all the platform, and I think I should put this question here also because you are joining us today. Ma'am, actually the question is, how are the states prioritizing who will get the COVID vaccine first?
Most of the, although health is a state issue, but the central government has made a statement that the people, the health workers, the frontline health workers, the people on the borders, the people with comorbidities, and people who are above 50, they will be given the first dose of vaccine on priority basis. Also, it also depends, we know that the demand is huge and the supply is less of the vaccine as of now. So there will be priorities given to these people first. This cohort will get the vaccine first, and maybe later on, the universal coverage will be done for this vaccine. It all depends how how early supply can be increased. It will take some time, of course.
Indeed, ma'am.
2021 is all about getting a vaccine.
Correct. Ma'am, my next question to you is how do you see the future of healthcare?
Future of healthcare, as in the delivery of healthcare. COVID-19, it has like never before the importance of technology has come. Um, People have every institute, has become a healthcare institute now. The smallest shop, a retail shop in the market, has become a healthcare institute. For example, you see, they have sanitation stations, they have uh, most of the companies, they will have quarantine centers, they will have how to detect people who are infected with COVID-19. Everything has become more technology driven now, and we have become more aware about the health now like never before, um, since we know that COVID-19 virus is highly infectious. Telemedicine has come into has become more important now. The frail, the old people, they should not visit the hospitals, they should stay in home. But then they do have these are the people who have the maximum healthcare need. So they need to stay at home but still have health care at their disposal. So telemedicine, the virtual medicine, it has become more a thing now. Also, work from home. There are companies who have already asked their people to stay home till 2022, but staying at home and working as well is not an easy task. It's very taxing, very taxing. There is no human interaction. The virtual interaction which we have today, this is the only means of human touch, So ultimately, mental health of these employees, mental health of people is going to become a huge issue now. So the complete shift of healthcare there has been a complete shift of healthcare. I mean, nobody in 2019 might have thought within a year things will go through such a huge change in healthcare. Healthcare was like one issue. We were all hale and hearty, and suddenly COVID 19 comes here, and the whole face of healthcare has changed. Technology, everything. We need healthcare robots, we need healthcare assistants who are robots, and so that the infection is not spread. We need systems which can take care of, which can provide us um, company, so that the mental health of the people, they find companion in those robots. So there's so many things uh, where technology has come into play in healthcare. So
Indeed,
this is
ma'am.
like a huge topic. We keep on talking for the whole day. Yeah.
It's okay, ma'am. I think you have very beautifully again explained how actually the COVID vaccine actually taught us health is wealth. I think we all need to understand this and move with this thought in this coming year. So, ma'am, my next question to you is, how do you think, ma'am, what do you think? What are the major challenges to healthcare sector in India?
We're a very diverse country, uh, Harsh. So, and a huge population as well. We need that one term which we call smart cities. We need that kind of a thing in India now. A place where there's a equity of healthcare. We also need to develop the technologies where uh, more people can live in a small space, but then there is no and but the spread of contagion, it is limited. The safety of mankind living in our country has to be taken care of in the first place. uh, then also there solutions which are more technology driven, which can target this huge population. um, it's the population in our country is very dense, and then there's also demographic diversity. We have places which are farther in south, which are farther in eastern areas, the northeastern areas, because it's something like, if even if you are not safe, I am not safe. It's something like this. So we need to restrict this virus through this cure, and this cure has to reach everyone. And the way how this will be done with the entire population will be a huge challenge for the government now. Right.
Correct, ma'am. I think it was really a very insightful answer from your side, and I must say that it's a kind of privilege that today we got the chance to hear all those things from you. Ma'am, my next question to you is, as you have previously mentioned that telemedicine has emerged during this pandemic very much. So, ma'am,
Mhm.
how will telemedicine impact the future of healthcare?
Oh, the telemedicine is next in thing now. Um, See, there are two things which we need to tackle. The first, we need to stop the spread of contagion, right? So the people need to stay at home and also receive their healthcare at doorsteps. When we say that the old people are not supposed to go out, the people who do not who have comorbidities, they should stay indoors. This is the cohort which will need a lot of care at home, at home, at their doorsteps. So telemedicine, the virtual appointments in using telemedicine will become more important. Also, as I said earlier, our country is very densely populated. So, when many people visit a neighborhood clinic, many people will stand there, many people will sit there. There's always um, chance of spreading this contagion. So through virtual medicine, more and more people um, can be adjusted by these doctors through telemedicine, and also, as you know, our doctor to patient ratio is too less. There are very less number of doctors in our country. So this this the doctors, they have to cater to such a huge population, and telemedicine will become a boon in that case.
All right, ma'am.
That is.
Again, yes, ma'am. I think again you have explained very beautifully, and I must say the things which you are telling us. I think that it will be fruitful for our viewers. Not only I think, but I do strongly believe that. Ma'am, my next question to you is: how do you see what will be the impact of AI, IoT, and robotics, which recently we have seen that the things are coming into the healthcare. So, ma'am, how do you look actually?
See, Harsh, as I mentioned earlier, we need smart cities now. Cities which are full of technology, where everything is smartly addressed, and Internet of Things and AI are going to play a huge role in this. Also, Internet of Things and AI have a huge role in day-to-day healthcare industry. Say, for example, we have these sanitation stations which are sensory. um, we actually do not even realize that technology has become such an important part of our day-to-day life now. uh, the sanitation stations, the precision medicine which we are talking about, everything is regulated by technology now. So AI and IoT are the next in thing in healthcare industry.
All right, ma'am. It was again a very quite insightful answer from your side, as you have mentioned that AI and IoT will be the future of healthcare, and I believe that whenever they are going to means all the things will be available in the small cities of the country. I think it will be the greatest achievement for the country. Ma'am, my next question to you is that what does the future hold for careers in healthcare?
um, Informatics, uh, telemedicine, AI, IoT, all these things all the careers which are related to technology. And since technology and healthcare are going to go hand in hand now more than ever, any careers related to these things, technology and healthcare, are going to be a boom. The coming times will see a boom in these kind of careers. That is what I think. So
All
all
right.
these people who are in computer, robotics, AI, they are going to have the the cream of the cake, So career is going to be that way. It is going to be a projectile in a extremely different direction now.
All right, ma'am. And ma'am, I have one more question, which is very common in every place. Actually, the question is, if in future, suppose that AI and robotics and whatever we call IoT will be introduced in healthcare, then do you believe that will it impact the future of employment?
The future of employment. See, robots are robots. AI is also the brainchild of a human. So if the question seems to uh, project that there will be more in unemployment because there will be AI taking care of most of the things, then the answer is no. Long back in 1990s, people thought if the computers will be there, the humans will be unemployed. But then nothing like that happened. We need humans, human mind, human hands to operate all those computers. And that is how it will go ahead as well. Uh, AI and other things, they are the brainchild of human. So human needs to control all these things. Uh, I mean, if say for example we are talking about telemedicine, ultimately a human mind has to sit there in front of the screen, a qualified human mind, they have to sit in front of the screen to tackle all those problems. It's just a easier way to do the customized life we are, the routine life which we have. It's just that it will be more easier through technology. It's just that it's not going to affect the employment of human beings. No, I don't think so.
Indeed, ma'am. We can say that we can conclude that the type of employment will shift. So we
Yeah,
can say that suppose that some people are today getting an employment in any other field. So we can say that the people will get employment in technical field. Or we can else
of
conclude
course.
this.
Education will become much more important than earlier, and we will need qualified people to handle all these machines which we are creating. The whole technology which we are creating, it has to be handled by all the learned people. So I think the importance of studying and skills will become much more important than the previous times. That is what I think. Yeah.
Absolutely, ma'am. It was a really wonderful answer from your side. And I must say that there's a lot to learn from you. But today we are a sort of time, so I don't want to take you much time. So moving to my last question of this session, actually, ma'am, it is not a question. It is actually seeking advice from you. What do you think? What are the things those actually the students those who are in their colleges, medical colleges, they should learn in their college days to make themselves industry ready?
Uh, as I said earlier, technology is going to become really important. Gone are those days when the people from our generation used to say, we do not have the skill to operate a laptop. We need human touch to interact. So we have moved on. This generation, the previous generation to which I belong, has suddenly adapted to the new way of life. The students of now, suddenly you have shifted from online on-site classes to online classes and adapted really well, right? So the skill set will also move accordingly, according to the times, according to uh, the challenges which will come, which will be offered to us with the moving times, but as of now, technology, learning more skills in technology, um, will become really important. uh, of course, we have to be more humble. We need to understand that that nature is powerful, and the less pangas we take with this nature will be much better, because this will come back to us, you know. So we have to learn the skills to work around this nature, not disturb it. That kind of a technology we need to develop. If we have to make ourselves comfortable in this natural environment which is called earth, that will become much more important, and the skill sets which work on these lines will be much favored during the next few years, more than before. We've always been into greener things, but this concept will become much more important now.
All right, ma'am, you have mentioned many important points, and one which I like the most is that I'm quite impressed. We need to work around we need to learn the skill to work around the nature, not to disturb that. I think we all need to we need to consider it, and we need to learn it. On this note, ma'am, I would like to wrap up this session, and thank you so much, ma'am, for joining and giving your important time. It was a healthy discussion with you. We look forward to conduct more session with you in future.
Sure, sure. The pleasure is all mine, Harsh. Thank you for having me here. Thank you so much.
Thank you so much, ma'am.
On the ground is where I stand. Never give up, that was always the plan. It's so cold outside, I'm alone, I'm alright. It's so cold outside, I'm alone.